So first thing you would do is come into the room and perform hand hygiene, provide patient privacy by draping the curtain, and inform the patient of what you're doing. So we're going to be doing a lower body assessment. Can you tell me your name?
Glenn.
Can you tell me your date of birth?
7/5/97.
Do you know where you're at?
Hospital.
Do you know what we're doing today?
No.
Who's the president?
Obama.
So then we would assess his vital signs, his BP, respirations, SpO2, pulse, temperature. What's your pain level right now?
5.
Okay. Your height and weight?
6 foot, 250.
Okay. So since we already did the upper body assessment, we would start head to toe, but since this is lower, we're going to start at his abdomen. We would look at his appearance. He'd lay down and we'd cover him up as needed. And we would palpate and see if it's soft. Move your hands, please. Soft or firm. You would start in the right lower quadrant and work around clockwise to listen. And you would listen for 5 minutes before saying they were absent. Do you have any stomach issues?
No.
What diet are you on? Regular?
Regular.
When was your last bowel movement?
About an hour and 30 minutes ago.
Do you have any difficulties urinating?
No.
You would, for men, you would ask if they have problems starting to scream. You would, and for females, you would ask when their last menstrual cycle was, if they have any problems, a hysterectomy, because if you do a bladder scan, it has to be on male, since they don't have anything inside. And if a catheter is inserted, you would check the tubing to make sure it's straight. So then when going down to the lower extremities, you would do all your pulses. You would assess the skin, see if his toenails look healthy. So you would do both at the same time, but you would do cap refill and check on each toe. Feel your pulses. You would assess for edema. See if there's any tenderness or swelling. And then you would have him push his feet against your hands. Try to lift your legs. Okay. You would check for skin breakdown on their backside, especially older adults. And since he has chronic back pain, we would have him lean up. You would move the gown, and you would check his back. You can feel it too, see where it hurts at. Do you have any back pain right now?
Yes.
What do you use to alleviate symptoms?
Aleve.
Okay. Do you use ice, heat?
Ice.
Ice. Okay. So then we would just thank them for their time. Do you have any questions before we go?
No.
And then we would foam out on the way out the door.